All right, we're back with the HIDEF Performance Podcast. We've got a very special guest today, Dr. Henry Pelto, goes by Hank Pelto. He's a former University of Washington team physician and associate professor. Currently practicing sports med at Virginia Mason, Dr. Pelto is also the medical director and team physician with the Seattle Kraken and your Seattle Mariners. Welcome to the podcast, Dr. Pelto.
Thanks for having me, guys. Really excited to be here.
Yeah, absolutely. Well, I mean, first question, because I know it's what everyone's going to ask. How did you become the team doc for the Mariners and the Kraken, and what made you want to go down that route?
Great question. Common one for sure. I guess I'll just tell you my path, which I think explains it as well as I possibly can. So I went to medical school, really not knowing what I wanted to go into. Like, cardiology was an interest of mine, but I kind of went in pretty eyes wide open just to the experience of different rotations and things. Early in my medical school career, I had a kind of preceptorship with a family medicine doctor, which was completely random, just happened to be that way, who I met up with, and really resonated with her and her approach to patient care, and how she saw family. I remember one day very vividly where we saw like two kids, a mom and a grandma, kind of in the same hallway all at the same time, and just the way she approached it, took care of people as a family, or took the kind of individuals, but also these family units, and really resonated with me, and it was kind of my path into family medicine. So I liked and the other piece, which is often a family medicine characteristic, is you kind of like a little bit of everything you do through the course of rotations and stuff. So I ended up going into family medicine and residency and came back to the University of Washington to do that. My initial intent was to be a general practice academic family medicine type of person. And then one of the rotations that we did as part of our curriculum and residency was with our sports medicine group. And it's relatively legendary, I guess, group at the University of Washington for primary care sports medicine. So I guess ultimately, part of my story is I'm a primary care sports doc, and really loved my rotation with them, and applying kind of the principles of family medicine, the way you can take care of patients, the approach to patient care, to more specific, orthopedic sports medicine, broadly defined problems. So that was my first kind of intro, really resonated with me. I remember my wife saying when I got home one day, she's like, "You're a little less grumpy this month than you have previous months." And so that was a nice trigger to hear on the outside too. So started working with that group more and more, and it went well, it went great. And I started, as a part of that, then kind of getting inviting myself, probably is more accurate, to some of the team coverage and some of those opportunities, training room opportunities, and that kind of thing that they did a lot. And that was even another level of just connection for me. I just loved the athletes themselves, but frankly, even more so, probably just the whole environment in which they exist, right? Coaches and support staff, medical staff around them, and how that group all comes together to support athletes in any circumstance, in any sport. And that's really what ended up kind of being a driving passion for me. I ended up doing a fellowship with that same group at University of Washington Primary Care Sports Medicine, and then I was lucky enough to stay on and work with them afterwards. So since then, my time has really been split kind of between clinical sports medicine, seeing mostly non-operative orthopedics, some cardiology stuff, some concussion stuff, and then team care. And so I was one of the team docs for the Huskies, as you mentioned. Initially took care of the women's basketball team and men's soccer team, and then eventually took care of the rowing teams, and got to help out with the football teams as well. And so that path was there. I was there for about 7 years. It was awesome. I started to get invited and asked to do some coverage for the Mariners, just kind of game coverage, and that evolved into a little bit of a broader role with them. And then when the Kraken came to town, they were looking for a primary care, or a whole medical team, I guess. And one of the biggest needs they had was a medical director and a primary care sports medicine person. And so threw my hat in the ring, and was lucky enough to get the opportunity, and moved over to Virginia Mason as a part of that. And now kind of still about half my time is clinical sports medicine, and the other half is taking care of some pretty crazy, cool, interesting, fascinating teams.
Yeah, that's pretty interesting contrast between like high level athletes and then the general population, but still fairly related. Tell us about like kind of what what you do on a day-to-day basis and what that looks like. And then also, I think some people are thinking like, oh, general practitioner, but you're kind of in the sports med field. What's the difference between, sports med general practice or how you approach it versus maybe someone's, general practitioner that they have currently that doesn't do sports medicine?
Yeah, I think back to what you said before, I do think there's a lot of overlap, and it's something that from my practice and just my professional life in general, I try and hold on to and keep in mind is that I really want to take care of people and help them achieve particularly the physical activity goals that they have. And sometimes that's the highest possible level of hockey, and then winning Stanley Cups as a team and that kind of thing. And other times that's pickleball tomorrow night, or whatever, a walk that you just haven't gotten to do with your friends lately. And so I think there's a ton of overlap there, and it's how do we approach this? What are the things what are your goals? What do you want to do? What's preventing you from getting there? And what tools do we have available to us to help you get there? And the stakes are different, the dynamics are different, but ultimately it comes down to that, to me, for almost anything I do professionally. And so tell me that, I think that now I'm missing the second part of what the question was.
Kind of what your day-to-day looks like. Like, are you, you mentioned some of the stuff, and I want to go into a little bit of detail of like, we talked about, you kind of mentioned orthobiologics and some of the treatment of those athletes, but kind of just describe what your day-to-day looks like, what you're doing, and especially with the activities with the team, like what you're responsible for the Mariners and the Kraken.
Yeah, I guess, as I said before, my day-to-day is kind of divided in half-ish. When I'm in clinic, I see essentially anything non-operative orthopedic. So I was in clinic this morning. I saw a 9-year-old who we were worried had broken her foot. I saw high school football player who had dislocated his shoulder. I saw somebody with a concussion. I saw a couple people with were kind of ongoing management of their arthritis. Somebody with some nerve pain in their upper back that we're doing some nerve treatments or trying to kind of figure that out. So I see a pretty broad range of problems, ages, activity levels, all that kind of stuff. So again, that's a little bit of the family medicine in me, I think, where just I've tried to stay as broad as I can, particularly in my clinic, just to keep the doors open to whomever wants to come in and get helped out and is motivated to work and get better and kind of put these puzzles together and figure out what we want to do. So that's the scope. I do everything, as you kind of mentioned before, from first visit, I just got hurt. What's going on? We don't know what's going on, or we're going to try and put this all together, to a little more, I guess, secondary, tertiary care type of stuff where something's been going on a long time, chronic tendon problems, joint problems, nerve problems, and we employ some of the more advanced treatments for those. I think the big ones that I do, PRP, certainly for management of pain and function and arthritis, and also chronic tendinopathies. TENEX we do for tendinopathies too, which is a percutaneous needle tenotomy, where we kind of clear out the tendon through the skin and use that to help as a treatment for chronic tendinopathies. I've been doing a fair amount of nerve hydrodissection too. So if we think peripheral nerve is involved in some of the problems that are going on around anything really, we'll inject those, distend around them and see if we can get some peripheral nerve release types of things. So those are kind of some of the, I guess, more tertiary type of treatments that we'll do. And again, that sometimes that evolves from me seeing a person the first time, and we go through that process, to people, HIDEF and others sending me folks like, we're just not getting this better. What other options do we have? So that's I guess a big, or the day-to-day of my clinical life. The team side of it is different and highly variable. I mean, in the particularly in the age of phones and Zooms and all that kind of stuff, I get texted a lot and visit the training room. I tend to, depending on where a team is, like in season. So Mariners obviously are in the heat of a playoff run right now, so we spend a fair amount of time troubleshooting, trying to refine plans and deal with anything that comes up. Again, sometimes that's phone calls and texts. Other times that's things around game time, during games, that kind of thing. Kraken are just getting back. Training camp starts next week, so we're in the process of just seeing guys again. They're coming to town. What happened over the off season? What went on at the end of last season? Are the things we need to clean up and make sure you're kind of completely ready and as healthy as we can possibly get you for training camp. So again, it shifts a lot depending on day of the week, time of the season, that kind of thing. But I try and be pretty present and available to team, staff, families, all that kind of stuff as part of my role as the primary care, both the primary care and then the primary care sports medicine doc for both of those teams.
Absolutely.
Yeah. I love that. You mentioned some of the treatments, and I think that people probably aren't super aware of. It seems like it's newer, right? Like PRP and the TENEX. Can you talk about PRP a little bit more? What you're doing with it, the results you've seen, and who may be a good candidate.
And then maybe also contrast that with the TENEX treatment and kind of when you would utilize each different type of treatment.
Yeah, sure. Yeah, they're both really interesting topics that we can, there's like literal week-long conferences about all of them, right?
Yeah.
Who should do what and when and where.
Yeah. I don't want to put you on any like divides here. I don't want to pitch you up against your community.
No, I
Break
thought
it down into 30 seconds. No.
Yeah, it's in the Cliff Notes version, right? Yeah. The PRP, platelet-rich plasma. We draw your blood, and we through some type of centrifuge process, we isolate just the platelet fraction out of your blood. Platelet fractions are the kind of often described as like the healing response part of our blood's the type of cell it does. So the thing that comes to sites of injury, opens up, releases growth factors, hormones that kind of stimulate a healing response. So the intent of it is we take just those platelets and we inject those back into some place that's chronically injured. And in the two biggest places that we inject them, or the two primary places that we inject them, are into tendons and into joints. A little bit of a different pathway to kind of think about for both of them. In tendons, the intent and our hope is that they're regenerative, or that they kind of trigger a new healing response there, lead to some better cross-linking in these areas that just do not have tendons, kind of classically don't have great blood flow. And so their healing response, or the ability for them to heal, particularly over when they become a chronic issue, is limited. And so our hope is that by injecting those back in, that we stimulate that response and get a healed tendon that then we're able to load and build and kind of get out of the negative spin cycle of the more chronic tendon problems. In arthritis, they tend to be in joints, I guess I should say, which is most commonly arthritis. It's more of a pain and function thing, not really a regenerative thing. We don't have things that can reverse all of the different processes that are happening in an arthritic joint, but just kind of changing the environment, shifting the environment to a better metabolic pathway in the joint to get people feeling better and doing more, and all the benefits that come along with that. So that's the thing about PRP. I mean, I tend to take a pretty in-depth, have a pretty in-depth conversation with people about PRP or any of these treatments that are kind of particularly chronic tendinopathies, and just understanding we don't know a lot about it. We don't, there's tons of variables. Like, do you have white blood cells in your PRP or not? What platelet concentration do you want? How many platelets do you want to put in, and what volume do you want to put them in? And there's a ton of science and research that's happening to try and refine that. And we don't have the best understanding of that yet, especially in terms of which tendon, how old are you, how long's that been going on, what's your activity level, what kind of load are you going to put through it. So I try and take people through that and have it be as eyes wide open as possible of kind of, this is what we're doing, this is why we're doing it, these are the pros and cons, the certainty and the uncertainty around it, and just know that, and know it's a process that we're going to have to go through together, and certainly with the other members of their healthcare team, particularly on the rehab side, to say, all right, can we get this flipped over and then do the work that we hope can really help heal this thing over a longer period of time. TENEX is a similar, kind of thought process, I guess, where we're kind of intervening on a tendon to try and get it out of this kind of chronically degenerative and worn down type of phase into a better place, rather than putting something in. TENEX is kind of fundamentally taking things out. So we make a small incision in the skin and then put a needle into the tendon that's hooked up to an ultrasound driven, essentially washing machine that pulses a little fluid in and then sucks the fluid and tissue back out. So the idea is really to kind of clear out, functionally what ends up is a lot of times like a scar in a tendon. So we get rid of that diseased tendon, and we injure the tendon again, right? So now we have this new injury kind of model that can then, or the hope is, progress along a healthy path or a healing pathway without that scarred tissue kind of preventing the healing from happening. The question of when do you do which is a fascinating one, and also much debated. There's, I think, better and better evidence than progression in my personal practice, and some might do that for tendon issues, the TENEX tends to be a more successful treatment, just based on the data that's out there. Again, there's a lot of variabilities in there, and I may eat these words 2 years from now, and you're like, oh no, if we get to this platelet concentration, that's what we want, and we go for it. The one that is very clear to me, from my practice experience at least, is that when people have kind of a calcific piece of their tendon, this gets a little into the woods of exactly what you're seeing. But if people come in and you say you've got a calcium deposit, which often comes along with these kind of chronic tendon problems, TENEX to me is much more successful when we just, I think, fundamentally getting that calcium out of there and allowing that healing to kind of come along without the calcium there. That's about as clear of an indication in this world of cloudy indications, for me to say like that's the one we should kind of go down and go pathway wise. Outside of that, again, I think it's experience, it's age, it's activity levels, it's kind of what have you tried and done before. Cost is a big issue for these too. I mean, as you know, most of these regenerative treatments are not covered by insurance, so come with some significant costs. TENEX is one that often we can work with insurance a lot more on, so that tends to be a more attractive and viable option in that context as well.
Yeah, that's a great way to explain it. Like, because a lot of people, don't understand the fact that you're kind of creating, I like how you said you create a new injury, but actually that's like just giving it a second chance basically to heal inside that tendon. And we've seen really good results with our patients that have gotten procedures for TENEX, for PRP. What I've always been curious, and not that there's not a place for surgery, but as a physical therapist, I don't really do obviously surgery and I don't promote that. And I've seen a like the non-surgical orthopedist role expanding, and like your guys' tools have really started to expand to become more popularized as well. What do you see for the future of non-operative like orthopedic management of injuries? Is it going to take over to the point, do you think, where you're not going to need as many surgical procedures because you're going to be able to handle it with these things like TENEX or PRP, or how do you see that in the future?
Yeah, I think it just completely depends on the problem. I think it's hard for me to imagine a window where orthopedic surgery isn't going to be an important part of our world for athletes and people who are active. But as you kind of, I think, alluded to or mentioning, there's some issues that surgical interventions and outcomes for just aren't great. And tendons are one of them. And I think the reason that PRP and TENEX and bone marrow aspirate, adipose, some of these other things that we and use or trying to use for treatment of chronic tendon problems really stems from the fact that the surgery is tough for these. It's hard to localize the actual disease area of the tendon surgically. Recoveries are long, outcomes are not as good as they are for other problems, a meniscal repair or an ACL or a full cuff tear, some of these things that have really good indications surgically. The chronic tendon problems just tend to be harder surgical fix, which again, to me, like, I guess we're in a world that explores opportunity, right? And when there's that window, this isn't the greatest. These their outcomes are not great. There's not great indications here. What can we fill into that gap? I see the primary care orthopedic kind of interventional, orthobiologic, all those different terms we put on it, continue to expand into that world. It's a problem for people and limits people and prevents them from doing the activities that they want to do. So I think as long as those windows are available, there's going to continue to be things that grow into them. I think it's, it can be fraught though too, right? Where it's, there's a lot of things that you got to be cautious about what we're advising our patients to do. What is the evidence? What's the cost? What are our outcomes that we're expected? Because the West can get pretty wild with these things a lot of times. You have to be, just have to be judicious about what we're doing and trying to be as I guess evidence-based as possible and not in a limited evidence world, and just put a lot of thought behind what we're offering our patients and then how we're discussing them with them and what we're promising and being careful to just be frank and honest with them about it.
Yeah. And I mean, that's a great way to put it too. And the good thing about it is, I think there's now options for people that had like something like a chronic tendon, tendinopathy and couldn't get a surgery, and then there really wasn't anything else besides like just taking ibuprofen and not using it. And so that's what I've seen that's cool for a lot of our patients, which is like some people that may have not had any like intervention that was left now has something. And I've, like I said, I've seen some people with some pretty chronic tendon issues get really good resolution of those problems with some of the things that you guys are offering. So that's been really cool to see.
Yeah, I totally agree with that. I mean, that's when we have conversations and good and honest and open conversations, people saying, well, especially colleagues or people, even I think probably even in other medical specialties of, well, where's the evidence for that? Or should you do that without that evidence? And, are, really fundamental. And I think that's a whole other debate that we can get into about the different things that we do with and without evidence. But what I say to them, and I try to say the same thing to my patients, is exactly what you're saying. Like when we're out of options and somebody's still, or these things that we've tried or that are more traditional or more rooted, we have it, and this is an option. And I think as long as we're frank and honest about what we know and what we don't know and what the pros and cons of them are, it is an option to try. And as you said, people do get better with them, and it's on us to continue to study outcomes and try and optimize it the best way possible. And that's the window to me, is if we're not getting better, there's not another great option outside of this. That's when I kind of really put it on the table for people, and again, just be very blunt and honest about what we know and what we don't know, and then we use some shared decision making to figure out if that's the right step for them or not.
Well, I think, at least from the people that we've had that have seen you, I think that, that's the feedback too, is, they trust your opinion just because you do put it out on the table. So, we appreciate that from you as well. Last question, just a little fun one too, because this is something that I've been curious on. And I bet a lot of people are curious, starting with the Kraken, the first year, last year was their first year in existence. What's it like to start with a team, a new pro team from scratch, and be with them for that first year?
I think the most fun and the most chaotic possible, right? Everything was new. Everybody's new to town. I think it was like, this is a little flippant of an answer, but or a piece of this answer, but there's, it seemed like there's for a lot of people involved with the team, there's kind of a divide of hockey new to Seattle or Seattle new to hockey, right?
Mm-hmm.
We're just as you guys know, and people around Seattle know, that the hockey culture here was not well developed, and man, to watch it go like crazy now is it's so cool. It's another opportunity for people, another pro team, and then that trickled down to the junior leagues and that kind of stuff. So it was interesting to kind of blend that of people. Like, I was relatively new to hockey, and then talking to a lot of the guys come to town and played hockey their whole life, but what's Seattle like, and what's our medical care like here, and what do we have available to us? And that was really interesting meshing. And then just, everything as it came up each time, it's like 1,000 things a day. How do we work through this, both as an organization and on an interpersonal level and in our community? And a lot of frustration, really a ton of fun. People involved in it could not have been better, more welcoming to me than they were. And it was just a really fascinating experience. You put COVID, I mean, that was, everything. I think we kind of forget too, is that was, COVID restrictions are largely gone now in that world, or this world, but we were dealing with a ton of them then, and testing and ins and outs of all that kind of stuff. So, on the medical side of things, especially our training staff having to deal with that, they did just an incredible amount of work, as all of them have through this whole process, to keep things going and keep people playing and try and keep people educated and healthy as much as they can. So I guess really fun chaos, I guess maybe is the right way to
yeah, no, I mean, I can't even imagine, like, you do forget about the COVID testing. We only had to deal with it a little bit on the back end for us. We helped out the Seahawks with some of their stuff when the guys couldn't get, there's a lot of rules, people coming in, they couldn't, if they left, they couldn't come in for a couple weeks. So man, that's definitely chaotic. And then all the NHL rules, built around that too. And you trying to manage people who are, getting sick or possibly exposed. I can imagine that'd be tough, on top of creating a whole new system and medical system and trying to get to learn. But Mitch and I went to one of the games. It was absolutely electric in the building, which has got to be fun. Are you down on the ice in the box? Are you going to most of the games, or how does that work for you?
You have to by NHL rules, you have to have a pretty robust medical staff there, just from the trauma potential and just the issues that can come up. So we're lucky enough, we sit, our doctor group at least sits a second row back from the ice, so
fun,
pretty good view and pretty sweet. Yeah, that place is awesome. I mean, the Key Arena as a Seattleite, Key Arena to Climate Pleasure Arena was a pretty wild step. It's incredible in there, and yeah, the fans bring it, man. Even on tougher nights, it's pretty fun to be there and to see the whole city rally around them and build that Kraken support groups.
And we've never been up north to the facility that you're at now, the practice facility, but I hear pretty amazing things about what you guys have going on up there as well.
Yeah, it's a fantastic space. I'd certainly encourage. We got to have you guys up for sure, and anybody else. I mean, it's a great community space. You know, it's kind of divided into. There's 3 rinks up here. One of them is mostly Kraken based, and the Kraken's training locker room, training room, equipment room, weight room is on one floor. All their administrative staff is on the floor above it. And that's around kind of one of the rinks, and then there's a great bar and grill, 32 bar and grill that is largely kind of in the middle of that second rink, and then
that whole area is gonna blow up. Like I've seen the pictures.
Yeah, that's another piece. Like if you're a Seattleite like me, like I always tell people, I think I'm sitting in Nordstrom's right now. Like the and everything's gone. Like it's totally turned over. So yeah, we have a great Virginia Mason clinic here, Starbucks, team store. Big open community spaces that they have done, and we're gonna continue to help promote some cool events. And so yeah, it's a great place to come up, get a coffee, have something to drink and eat, and watch some hockey, bring your families up for open skates and stuff. It's a pretty sweet place. And then yeah, everything around it is going crazy too. There's gonna be more restaurants, more living, more shopping, all that kind of stuff. So it's a cool spot.
Awesome. That's awesome.
For sure. Yeah. Well, Dr. Pelto, ending this, is there anything that you want more people to know about your practice? Maybe like shout out where you're at, how they can get a hold of you, anything like that?
Yeah, Brandon, just I think arcing back, like if you're out there and you're struggling with something medically that we can help with, I'd love to see how we can help you through it. Come one, come all, ages, problems, anything like that. I practice pretty exclusively up at through Virginia Mason, and we're up at the Kraken Community Iceplex up here, just on the south end of it. It was great, small but awesome clinic with physical therapy, ultrasound, X-ray, fantastic primary care doctor named Amy Portacci's up here with me too. So we have a great clinic here. Love to see people if they want to come up. Our clinic number, if anyone wants to give us a call, is 206-341-3000. And then I'm happy to have people email me too. My name is henry.pelto at vmfh.org. So if you're out there and I can help you with anything, give us a call, shoot me a note. I'm happy to help any way we can. Work a lot with these HIDEF guys. It's an awesome relationship and really appreciate them. And yeah, just happy to help if I can.
Thank you. And we'll link up all that in the show notes. So it'll be on the podcast, Spotify, and then it'll be on all the posts. So we'll get it out there as well. We appreciate you taking the time to stop by. We know you're busy with a couple teams, and your whole practice. So we appreciate your time and thanks for coming on.
Happy to do it, guys. Good to see you, and we'll talk to you soon.
Awesome.